The most comprehensive study, summary of evidence on diet and cancer ever compiled recommends we eat foods of plant origin to help prevent cancer. This means centering our diet around whole plant foods, not just whole grains and beans every day, but every meal. And when it came to foods that increase cancer risk, they were similarly straightforward. Unlike some other dietary changes that kind of wimp out and just advise people to moderate their intake of bad foods, like eat less candy. The cancer guidelines didn't mince words when it came to the worst of the worst. For example, don't just minimize soda intake, avoid it. Right? Don't just cut back on bacon and hot dogs and ham and sausage, lunch meat. Avoid processed meats, period. Because data do not show any level of intake that can be confidently be shown not to be associated with risk. Even small amounts may be risky. Processed meat can not only be thought of as a powerful multi-organ carcinogen, but may increase the risk of heart disease and diabetes. Red meat was bad, but processed meat was worse, and that included white meat, like chicken, turkey slices. So with more heart disease, cancer, and diabetes, no surprise, processed meat consumption is associated with increased risk of death, even at small amounts. In Europe, they calculated that reduction of processed meat consumption to less than half a hot dog's worth a day would prevent more than 3% of all deaths. This was the second largest prospective study on diet and cancer ever, a study of 400,000 people. Well, the largest ever, 600,000, was done right here in the U.S., the AARP study. They found the preventable fraction to be even higher, suggesting that 20% of heart disease deaths among women, for example, could be averted if the highest consumers cut down to less than like a quarter strip of bacon's worth a day. Right? That's a lot of death. So what does the meat industry think about all this? In the journal Meat Science, the industry acknowledged that the cancer prevention guidelines now urge people to avoid processed meat, a statement that represents a clear and present danger to the meat industry. Processed meat, they say, is a social necessity. How could anyone live without bologna, right? The challenge for the meat industry is to find a way to maintain the consumption of these products while somehow not damaging public health. Well, they've considered removing the nitrites for decades because of the long-known toxic effects. The industry adds them to keep the meat pink. There are evidently other coloring additives available. Nevertheless, it's going to be hard for the industry to change. You have to balance all that cancer with the positive effects of these substances as preservatives and desirable flavor and red color developing ingredients. No one wants green eggs and ham. It's like salt reduction in meat products. They'd like to, but one of the biggest barriers to salt replacement within the meat industry is cost, as salt is one of the cheapest food ingredients available. Now, there are a number of taste enhancers you can inject into the meat to help compensate for the salt reduction, but some of the compounds lead to a bitter aftertaste, so they can also inject a patented bitter blocking chemical that can prevent taste nerve stimulation at the same time. The first of what may become a stream of products that are produced due to the convergence of food technology and biotech. Or they can always start adding non-meat materials to the meat. You could add fiber or resistant starch from beans that have protective effects against cancer. After all, the United States dietary fiber is underconsumed. This is a meat science saying, underconsumed fiber, indicating that fiber fortification of meat products could have health benefits, failing to note, of course, that their products are one of the reasons why America is so deficient in the first place. The industry is all in favor of causing less cancer, but obviously such optimization has to achieve a healthier product without affecting the hedonic aspect. It's important to realize that nutritional and technological quality in the meat industry are inversely related. An improvement in one leads to a deterioration of the other, so you got to balance it out, right? They know that the consumption of lard is not the best thing, heart disease being our #1 killer. However, those downsides are in sharp contrast to lard's technological qualities, which make saturated fats indispensable in the manufacture of meat products. Otherwise, you just don't get the same lard consistency. See, the pig fat doesn't get hard enough, and as a result, a fatty smear upon cutting or slicing can be observed on the cutting surface of the knife. Right? So look, you got to get your priorities straight, right? Although the evidence for the relationship between colorectal cancer, at least, and processed meats cannot be denied, the meat industry suggests further research. For example, compare the risks of eating meat to other risky practices: alcohol, inactivity, obesity, smoking. Compared to lung cancer and smoking, maybe meat wouldn't look so bad. But don't worry, consumers probably won't even hear about the latest cancer prevention guidelines. Consumers today are overloaded with information, thus the industry can hope that the dissemination of the update on meat and cancer drowns out in this information cloud. And even if the consumers do see it, the industry doesn't think they'll much care. For many consumers in the Western world, the role of healthfulness, although important, is not close to taste satisfaction in shaping the final choices of meat products. It is hence questionable whether the revised recommendations based on the carcinogenic effects of meat consumption will yield substantial changes in consumer behavior. You know, doctors and nutrition professionals feed into this patronizing attitude that people just don't care enough about their own health to change. This paper from a leading nutrition journal scoffed at the idea that people would ever switch to a prudent diet, reducing their intakes of animal protein and fat, no matter how much cancer was prevented. The chances of reducing consumption to avoid colon cancer, virtually nil. Consider heart disease. Well, we know we can prevent and treat heart disease with the same kind of diet, but the public won't do it. The diet, they say, would lose too much of its palatability. In other words, the great palatability of ham largely outweighs other considerations. Although health and well-being are increasingly important factors in consumer decisions, this 1998 industry article feared that unless meat eating becomes compatible with eating that is healthy and wholesome, it could be consigned to a minor role in the diet in the coming decade. Their prediction didn't quite pan out. Here's meat consumption per person over the last 30 years, rising. Now, 1998 was when the Meat Science article was published, worrying about the next decade of meat consumption, which continued to rise even further, but then did kind of sort of flatten out before it fell off a cliff. Per capita meat consumption down about 10%. Millions of Americans are reducing their consumption of meat, so don't tell me that people aren't willing to change their diets, yet we continue to get diluted dietary guidelines because authorities are asking themselves what dietary changes could be acceptable to the public, rather than just telling us what the science says and letting us make up our own minds as to whether, pig fat smearing on knives should trump our family's health.